Hello everyone, this is Charles Clinton, internal medicine resident and in Savannah, Georgia. This video probably was made specifically for you as someone who is interested in research, but if this video helps out other people, that's the idea. So basically, a couple points about research. So research, what is it? It's basically going the extra mile, right? So usually you're working here X, Y, you're doing what you have to do in the university, you're doing what you have to do in the hospital. So research is gonna be extra, right? What is extras? What is basically you put in an additional effort, be it you having a protected time to just do research if you're in a research oriented place, or actually have to work when you're off from work, which is like right now I'm on my day off, but I don't have any like research protected specific time to just be able to think about research. So I have to do what I have to do. So here we are making this video, and the reason for this video is just to guide you a little bit with some things I start learning about research. So I come from Costa Rica. I did a cardiology residency over there. Time for research was almost zero because we had we had a lot of work. We had to work throughout the night and all those things, and there wasn't even any clear culture of doing research or any specific need to do research, and that wouldn't catapult you mostly anywhere, right? So it's good that they would see on your CV you had research, but not many people had research. So the playing field is pretty leveled on most occasions. Here in the United States and many other parts of the world, research is basically sine qua non with some acceptances into certain specialties and Ivy League places. So basically, if you have no research, you might not even be taken into account to get into X or Y, even if you have all that it takes, right? And you're a great person, great professional, etc. So that's one of the main drivers for medical students and residents to do research, which is, you will fill your CV, and by filling your CV with these things, it's just have a strong CV all throughout. So you check all the boxes. One of those boxes, and a very important box here in the United States, is research, right? That's it. That's as simple as it. So if you're going into a area or a place that is not that competitive, and by competitive, I don't mean it's gonna be the best place out there. By competitive, what it means is just it's very difficult to get into because there's a whole lot of people wanting to get into. So supply demand is very disproportionate. So the supply is gonna be very high, and the supply is gonna be very. Let's see, supply. Shit, how was it? Supply is gonna be very low, and the demand is gonna be very high. Supply very high and demand no. You get the point, right? You get the point. The point is that a lot of people want to get into that place, and there are just 2 spots, and 100 persons are participating. So, of those 100 persons, if you don't have research, maybe the person who is the same as you that has 2 publications will get into it. So that's one of the main drivers for research in the United States. Another driver, which I believe is even more is wholesome, is to actually try to make an impact, to make a change, to improve healthcare as a whole, to impact lives, because through research is that we end up getting these theories that become the hypotheses that end up becoming full-fledged clinical trials, where we get eventually to randomized controlled trials, and from which we base evidence-based medicine. So that's a good starting point. There's different types of research. I won't go through all of them right now, most of you, if you're seeing this video, probably are thinking of the simplest way of research for medical students and residents, which is going to be a case report or clinical vignette. That's basically gonna be talk about one specific case, one specific patient, and what is interesting about this case or about the case in general. Like it could be the management, diagnosis, high value care. So there are different options, right? After the case report, it can get more and more complex, right? It can become a case series, or after a case series, which are several cases which are similar to each other, it could be other epidemiological research study where you actually see incidents, you see frequency of things happening, and you try to start see patterns. So this pattern recognition gets more and more complicated until you can go into a cohort and you can see if there is exposure to X or Y risk factor, and if that changed anything in the patients in the two groups, the control group and the exposed group. And then it can get even more complicated, right? But of course, research also includes just descriptive things, not analyzing and not seeing things prospectively or into the future. It also takes into account seeing things backwards or retrospectively. And there's the other option, which is also just looking at what there is already out there, such as a meta-analysis, which is, okay, all these studies have been published, now let's go analyze them. That also takes a lot of effort and time, so most of you just starting off with research usually is not going to be your go-to thing initially. You could also do a review of the literature. You could also do a quality improvement project wherever you are currently working, right? So there are many options in research, but most of you, maybe 90 or more %, will first encounter research through a clinical vignette or case report. So it's basically, okay, I'm going to talk about this specific case. This was interesting with the case, and I'll go try and present this somewhere. I'll submit this abstract somewhere. If they accept it, I'll have to work on possibly a slide, be it a PowerPoint slide or keynote that you will have to print out, and that's where you will be in front of your poster and you'll do the poster presentation. If this presentation is great and it might be voted and upgraded to become a podium presentation, meaning that you might present this actually not beside all the other posters, but actually like have a small, very like sort of small lecture about it. So that's why it's like podium. You're gonna be in a select group of people who are going to present this case report or case series to a larger audience probably, and it's gonna be a little more select group because podium presentations are gonna be maybe 5 and case report presentations will be all the others posters that were accepted, which might be 100 or more. You get the point. Okay, so with that brief introduction, we already talked about research, why you might pursue research in general. This benefits anyone who wants to actually make a change, number one. If it's because you want to understand how research works and you want to eventually be able to even appraise the literature and understand if this article means what it actually is saying, or does it actually, even if it says that X or Y intervention works, but through you doing research, you will understand and you'll be able to say, no, I think this actually doesn't change my way of thinking and won't change my future management. So a way to understand that is by you yourself trying to go into the area of research. Probably you won't be able to do that just by doing case reports, but that is your first step. So if you want to make an impact, I would recommend you to do research. And the second option is if you want to get into a competitive position anywhere in the world, more so in the United States and countries like the United States, research will be something that is going to be a checkbox that they might even ask you about, or it could be a great conversation starter, etc. So that's the initiation or the intro I'm giving to this research talk. I didn't prepare this. I'm just talking of what I think is necessary for me to transmit to you, as if I were here sitting in front of you and talking to you, and you're asking me like, should I pursue research, yes or no? That would be my answer. I explained a little bit about what are the different options of research, and that's about it for this introductory video. So now we'll move on to the next video, and the next video will actually be based on a clinical vignette or apps or case report. So we will talk more about that, and that's going to be our next one. Of course, this video is not all encompassing, so just give me feedback. What do you think? And yeah, we're going on to the next video now. So see you in the next one.